Good afternoon. Thank you, Senator Markey and Representative Fletcher, for having me here today to speak about the attacks on birth control and the critical role of Planned Parenthood health centers. My name is Nicole Clegg, and I am the CEO of Planned Parenthood of Northern New England, which serves more than 32,000 patients annually through 14 health centers across Maine, New Hampshire, and Vermont. Contraception is a key component of reproductive health care. The decision about whether, when, or how to become a parent is one of the most important life decisions we make. Contraceptives can also help alleviate symptoms of debilitating periods, prevent the risk of cysts, and lessen risk of endometrial and ovarian cancers. Birth control is essential health care. Access to it is necessary and popular. Nearly 9 in 10 women of reproductive age have used birth control, and nearly 9 in 10 adults agree that everyone deserves access to the full range of birth control methods, no matter who they are, where they live, or their income. Last year, Planned Parenthood members nationwide provided 2.2 million birth control services to patients. Today, family planning providers are navigating increased demand for services following the Dobbs decision and the election of President Donald Trump. To be clear, our patients are worried that politicians and judges, not their trusted medical providers, are deciding whether they can access birth control that is right for their needs. Their concerns are valid. We knew opponents were never going to stop at overturning Roe, and this month we saw the latest attack on reproductive health care become law. As you know, Republicans in Congress passed President Trump's reconciliation bill to defund Planned Parenthood by prohibiting certain member organizations from receiving reimbursements for the non-abortion sexual and reproductive health services we provide to Medicaid patients, just as other providers do. This policy is devastating for our patients. For many, we have been their trusted provider for years, even decades. They have disclosed trauma and sexual assaults. They have sought help because their relationship is unsafe. We have held their hands when they suffered a miscarriage. We have connected them with specialists when we suspected cancer. We have provided them with the birth control method that is best for them. And we have listened without judgment and offered some of the best care a patient can receive in this country. The most recent attack is part of their long-term goal to shut down Planned Parenthood health centers and ban abortion nationwide. Nearly 200 Planned Parenthood health centers in 24 states are at risk of closure. The vast majority in states where abortion is protected and legal. President Trump and his backers in Congress are putting patients' health care at risk, including more than 8,000 patients in Maine, New Hampshire, and Vermont. 70 million Americans rely on Medicaid for health insurance, including more than 1.1 million Planned Parenthood patients. More than half of Planned Parenthood health center patients rely on Medicaid. Prohibiting Planned Parenthood health centers from participating in Medicaid will hurt our patients and is expected to cost taxpayers more than $50 million, according to the Congressional Budget Office. Not every healthcare provider accepts Medicaid, but Planned Parenthood does. And we are proud to provide care to all, regardless of a patient's ability to pay. Across this country, Planned Parenthood is sometimes the first and only healthcare provider patients see in the entire year. There is no other provider who can step in and replace the essential life-saving healthcare services we provide. We operate in a healthcare system that does not adequately reimburse us for the care we offer. The reconciliation bill, coupled with the Trump administration's decision to withhold already appropriated Title X family planning funds, means our organization is facing a loss of $5 million this year. This is not something we can sustain. So far, in 2025, at least 20 Planned Parenthood health centers across 7 states have closed or announced plans to close. Planned Parenthood of Northern New England has been forced to close a total of 6 health centers since 2022. And the impacts of those closures are still felt in those communities years later as we navigate continued gaps in care. If we are forced to close additional health centers, it would have devastating ripple effects on our already fragile healthcare system, leading to longer wait times and increased costs for everyone, not just Medicaid patients. People in rural states face unique barriers, and they already travel far distances to get the essential care they need. This will only get worse. Over 60% of Planned Parenthood health centers are located in medically underserved areas. In New England, where it can take hours to reach a healthcare provider, we are seeing rural hospitals and providers close at alarming rates. We need champions in Congress to continue fighting alongside us. So thank you for holding this hearing, and we look forward to your questions.
Thank you so much. Thank you for your testimony.